Cushing's disease. The name may sound similar to the comfy adjective cushy, yet don't let that fool you. This disease is anything but. This condition is caused by a tumor in the pituitary gland, a pea-sized body attached to the bottom of your brain. Tiny but mighty, this gland is in charge of regulating the hormone production organs across our body. In Cushing's disease, patients suffer from an excess of cortisol, a hormone regulating stress. Patients suffer from weight gain, hair loss, increased bruising, anxiety, and depression. All of this drastically decreases the quality of life of patients affected. Now, I'm sure many of you first imagined a person when I described those symptoms, but Cushing's disease affects not just man, but man's best friend too. Due to its proximity to the brain and rarity in people, the disease has been understudied and treatment options are limited. Surgery is often inaccessible, and medical therapies only alleviate the symptoms and don't treat the tumor itself. There is a critical need for better care in both dogs and humans for this disease, which is what my research aims to address.
My name is Saumya Gade, a DVM PhD student here in the CVM Precision One Health Center and School of Medicine at UGA. My project is centered on the comparative nature of Cushing's disease and how we can utilize an interdisciplinary approach between humans and dogs to improve our understanding and quality of care for this illness.
My research focuses on two categories. Firstly, the utilization of biomarker imaging to evaluate the molecular characteristics of Cushing's disease. In Cushing's tumor tissue samples, we can stain and identify proteins and genes involved in secretion of excess hormones like cortisol. This will give us in-depth knowledge on what cell populations are contributing to the disease, greatly improving our understanding of how the disease develops and progresses. We will also identify protein biomarker targets, proteins that can then be targeted with drugs to attack and kill the tumor. Secondly, the application of this knowledge to treat pituitary tumors in a laboratory setting through the development of something called patient-derived organoids. Organoids are 3D culture systems that can grow infinitely and are derived from stem cells and tissue biopsies. Using an organoid model recreates the cellular structure of the derived patient tissue, in this case the tumor, and provides a personalized approach to testing tumors against medical therapies. With this, we can test the effectiveness of drugs against tumor cells and apply that knowledge to treating patients in clinical settings.
As someone who's worked in veterinary clinics for over 4 years, I've seen the heartbreaking effects of Cushing's disease firsthand, and I'm passionate about trying to help the lives of those hurt by it. My research findings will improve the treatment of Cushing's disease in both human and veterinary clinics, benefiting the hundreds of thousands of lives impacted by Cushing's disease every year.
I would like to conclude by thanking the ARCS Foundation for your consideration and the opportunity to be selected as a finalist. Thank you.